Hey guys, Dr. Aaron Miller, physical therapist, orthopedic and manual physical therapist, back again with my series on foot pain in the foot. This week's episode or series episode is going to be about a diagnosis that we see all the time, or something that we evaluate during standing and walking, and that's pronation of the foot, and the pain that it can cause and how we actually dive in and look at treatment of it, and what I do for that. So pronation is a common word and phrase that's used, and it's when the foot dives in. So if I bring my foot up here for you to see, so from two different angles, this right here is considered pronation when the foot dives in from the side, or if we swing around to the front, when it dives in like that. Now, what you see also when I put weight and a foot collapses in like that is that it also tracks my knee and my hip to go in. Now, these are very common issues you have with pronation. So typically what's done is that people will get orthotics. But the problem with the orthotic is that, yes, it will stop the foot from collapsing down, but it doesn't solve the underlying issue. So a lot of times I'll get a patient who comes in who still has foot pain, and it can be either with pronation, it can be either, I'll show you here again, it can be on the inside here, it can be here. If we flip to the outside, it can be on the outside here, okay? And so with those pain generating areas, it's the stress points that are on the foot, and the orthotic will be good to correct the position of the foot, but it doesn't do anything to correct why the foot gets in that position, because there are two types of pronation. There's a structural flat foot or a pronated foot, which means the bones are actually fallen, and then there's a functional flat foot, where when you're not putting weight on your foot, you actually have an arch. And when you put weight on your foot, that arch collapses. Okay, so there's a treatment for each. The structural flat foot, I think, does result very well with an orthotic placement, but that's maybe 5 to 10% of the patients that I see. The structural one is way more common, and the big reason why that foot collapses in is because the strength of the muscles underneath that foot to hold it is not there. We talked a little bit about strength with heel pain as a more of a secondary treatment for that. But when you have pronated or flat or dropped arches, that's not a structural issue. That strength in the foot and feet is paramount to make sure that you test for it, and to make sure that you can actually contract those foot muscles when you need to, because you got to be able to stand and be able to maintain an arch in a standing position. A couple of reasons why the foot can dive in like that is the strength of the foot, but because the driving factor when that foot dives in, or the secondary factors I should say, when the foot dives in, is that the hip and knee go, we also have to look at the hip strength here when you put weight on it, and the quad strength to do that. So when a person is going up and down stairs and their knee dives in, their foot collapses, you can't just look at what the foot is doing and the strength of the foot. You have to look up higher in the chain to be able to treat and strengthen those other areas as well. So just a few indicators of if those things are happening, what you need to do for that. I would guess it'd be strengthen the hip and the foot, but unless you get it evaluated, you're not going to know what to do. And Googling and YouTube is always a common thing people do, but again, there's not a professional there guiding your way and looking at how you do it. So I'd recommend getting in to see a professional. It's something that's pretty easy and to fix and very common, but can result in a lot of pain, not only in the foot, but the hip, the low back, the knee. So another series of the foot here. I have more, so be on the lookout, guys, and I appreciate you tuning in, and hopefully it provides some answers to some of your foot pain that you're getting. Thanks for tuning in. Bye.